Lord, we come before you in various states of being scattered. Would you gather us, turn our hearts towards you, and may your word and your purposes be accomplished in this time. In Jesus' name we pray. Amen.
Amen. All right. Well, thank you everybody for being here. And yeah, we're looking forward to today. So the last 2 weeks, just as a recap, we were covering kind of questions around causes of mental illness. That was week 1. And then last week we really looked at, can mental illness exist in Christians? And are faithful Christians able to sort of acknowledge the existence of mental illness? So today we're going to be sort of presupposing that mental illness exists and that Christians can have mental illness. We're going to be looking at what specifically do you do yourself or for a friend or family member if somebody is struggling with mental illness. So we're going to be going into more specifics in terms of mental health treatment today, as opposed to kind of covering the more broader theological issues, but we will touch on some different questions around faith and mental health too. So as always, we really welcome questions, disagreements, concerns, and we'd love to hear experiences from you all. All right, so maybe we're going to focus today on kind of 3 questions: the who, what, when, where, and why of seeking mental health treatment. So we'll try to bring our professional sides in a little bit in terms of offering some input on mental health treatment, as well as obviously talking about the faith aspects as well. So Stephanie, do you want to start us off with starting us off with the who?
Yeah. So in terms of like who does professional mental health treatment, kind of like the 2 big categories are therapists and medication management helpers. And so in terms of therapists, Elena can talk a little bit about what kind of training goes into that. In terms of medications, these are generally MDs, APRNs, they can be DOs as well. They're people who've kind of had a little bit more of the biology training in order to kind of differentiate, where are, in terms of the mind-body connection, where depression might manifest as lethargy or tiredness or trouble eating. Is it something related to a thyroid hormone? Is it a vitamin deficiency? And so having a little bit of training around how that integrates into the physical body is part of the work of an MD. Some of the medication providers will also do therapy. And so a therapist can have like any number of credentials, but just kind of depending on the practice, that would be something important to know. Whether they concentrate mostly on medications for mental health conditions or whether they also integrate therapy into it. So sometimes people have split treatment where they have, one person doing the therapy, one person doing medication management. But sometimes, and this will usually be in private practice, where they integrate both with that piece. But if you want to talk a little bit more about that.
Yeah, so in terms of therapists, I think this is going to be an overwhelming process. If you're like, I need therapy, I know I need to talk to someone, how do I possibly find who I should talk to? And that's really overwhelming. And I say that as a therapist, I think it's really overwhelming to navigate the system. So we're kind of get to the general professional side and then the Christian side. So in terms of therapists, a lot of people online can sometimes call themselves therapists or counselors or that type of thing. It's important to make sure somebody's licensed if you're looking for professional mental health treatment. There's life coaches and different people who might have the term counselor or coach or something like that who don't actually have a professional mental health license. So you'll want to look, and somebody online, their profile should list I'm a licensed social worker, psychologist, or clinical mental health counselor in the state of Connecticut, or they should be in the process of obtaining licensure, which means they're still working toward their hours, but they're under supervision of somebody who is licensed. And that's fine too. But sometimes I think I look at certain online profiles and I'm like, oh, this person's marketing themselves as a therapist, but they they might not be a bad person to talk to for some things, but they haven't actually obtained a professional licensure to be a therapist. So it's important to note that. And we'll get into this in a little bit, but there is a category of biblical counselors, and we're going to talk a little bit about that in terms of differences between biblical counselors and professional mental health professionals. But biblical counselors are not usually licensed therapists. I suppose somebody could be have a double sort of degree, but biblical counselors are sort of a separate category. They have not received professional mental health training. So in terms of who do you look for, I think it's really important, and we're going to talk about, like, do you need to see a Christian? And we'd love to hear kind of everybody's perspectives about that. But finding somebody that you trust is really good, and finding somebody who just feels like a good fit. And I usually tell people, like, if you've gone to see somebody 3 times and after the 3rd time you're like, I think that's a pretty good sign that you can look elsewhere. Because if you're really opening up about really vulnerable things, it's important to feel like the person understands you can trust them. Sometimes after the first time, especially if it's your first time going to therapy, it might feel so weird that you might not necessarily feel connected to that person right away. But 3 times I think is usually enough to have a gut feeling of, like, is this good or not good? It's also great to get referrals from friends or our elders to make professional mental health referrals. So if you can get a recommendation, like, oh, someone I know saw so-and-so, that can be nice just to have a little bit of a personal connection. So yeah, those are a few notes. Anything you'd add to that, Stephanie?
No, I think, and we can talk a little bit more as we segue into kind of something we've heard often is, does my therapist or psychiatrist need to be a Christian in order to really kind of understand that? And I think we talked about this a little bit, and we landed on, it could be helpful, but I think that depending on kind of what that topic might look like, but really that idea of, opening yourself up, do you feel like this person is trustworthy and competent? Those are probably going to be more important. And other factors such as, like, if they take your insurance, if they're geographically located, if they don't take insurance, are they affordable in some way? Those might be more salient factors than, is this person a Christian? And I think I would also note that even if someone is saying, like, oh, I'm a Christian therapist or psychiatrist, right, that spectrum of Christian beliefs is so big as well that even if they're saying that they're Christian, that doesn't necessarily mean that they hold the exact same beliefs, core beliefs as you and the sense of the world. And so even figuring out kind of where they might be and how that translates into the therapy process is something that shouldn't be assumed.
Are you using the term biblical counselor and Christian counselor interchangeably, or are there 2 distinctions?
2 distinctions.
Okay.
So biblical counseling, and we'll talk about that. We might say biblical counseling for our next section, but biblical counseling is folks who are not trained mental health professionals, like they don't have graduate level training in mental health treatment, but they've gone through a program for biblical counseling, which is really the process of using prayer and scripture exclusively to treat mental illness or mental health diagnoses, versus a Christian counselor, usually a Christian therapist, will be a Christian and perhaps bring in prayer or other sort of biblical principles or things like that, but they're also employing psychological treatments that are sort of more broadly used. So I'm curious, so yeah, Stephanie and I had some different ideas around when is it helpful that you probably should see a Christian, when is it more important to see someone who is competent in your area that you're seeking treatment for. And there's a lot to be said about that, but I'd love to hear from people just as you think about seeking mental health treatment, therapists, like how important does it feel to you that they're a Christian or not? And what have been your experiences with that either way? We'd love to hear.
Either yours or people that you know.
Mm-hmm. Yeah.
I think for me, as a person that been recently trying to seek that out, I think it's been harder for me trying to seek out a Christian therapist, counselor, or anything, because I feel like in a lot of different ways, especially in the area that I live in, like I'm surrounded by therapists that don't look like me or don't understand like where I'm coming from. So I'm just like sometimes struggling mentally in like my day-to-day life or like Christian life. It's like it just seems so complicated to talk to certain type of people. So sometimes like
Yeah.
I don't think that's like the best thing for me.
Yeah. It's like other aspects of identity can matter too. Yeah, for sure. For sure. Absolutely.
Yeah.
Yeah. How about other people who feel it's important to see a Christian or maybe hasn't been? Pros and cons.
I think it's important.
Yeah. Say more. What has been helpful for you about seeing a Christian?
The same beliefs based on what God teaches us in the Bible. How to treat each other and how to deal with issues and problems.
Yeah. Yeah.
Because non-Christians may not have, they probably don't have all the same values and goals.
Yeah.
Right. And this is where we kind of talked a little bit about, if you can't find a Christian therapist, that maybe it could be enough that they're faith affirming, right? And so that they're not trying to, impose any sort of their beliefs or worldviews on you, but really trying to work within your framework of understanding and how you feel, your goals are influenced by Christianity. And so I think that there's a difference between, a therapist who's kind of maybe actively telling you some of the things that you're bringing into the room are not helpful and kind of dismissing it versus somebody who is genuinely curious about, what matters to you and how can we work around this issue so that what matters to you gets accomplished. And I think also just kind of even within Connecticut, it may not even be an option to see a Christian psychologist or therapist because they are few and far between. And so I think having somebody who is faith affirming or at least open and not trying to kind of tell you it doesn't matter would be an appropriate place to go.
So with that, like, when we get like stuck in that groove of them telling us all the things that we need, like want to hear, versus some of the hard things that we need to hear. Like, so just like that's why I understand, I don't think I could like agree with the same thing as like we have to be dealing with Christian people in order to talk about our struggles in mental health and like all these other issues we have. Like people outside of our circle can't give us advice or feedback on like the good of the world and stuff. They don't believe or what we believe, but how do we even know what they believe until like we get to know them? And their job is not to allow us to get to know them really like that, more so for them to help us understand us. So I don't know.
I think those are
a couple
good points.
thoughts, kind of along those lines of like, when is it most helpful to seek out a Christian versus maybe when is it not something absolutely necessary? I think, so for instance, like if your mental health concerns are very sort of interwoven with spiritual concerns as well, so perhaps maybe if you've experienced spiritual abuse and or abuse in a church context and your mental health is very much tied with like trying to find a way forward in your faith despite having experienced spiritual abuse, for me, that would be harder for me to see not a Christian for that personally, right? Because it's like, oh, I really want someone to help me find a way forward in my faith. Like, in myself personally, I've seen a few therapists. I think 2 are Christians and 1 is not. And I've had a really good experience with my current therapist who's not a Christian, but I've had a different kind of really valuable experience with therapists who are Christians. I think just depending on kind of what you're looking for. So if, there's this spiritual abuse issue, wanting to understand how depression and faith go together, a Christian therapist is probably best for that if you can find one. If it's like, for example, you're dealing with a tic disorder and you need a very specific form of treatment, it's called habit reversal training, like to help you not sort of prevent verbal or motor tics. It might be nice to see a Christian for that, right? Like, all things being equal, I would probably always rather see a Christian who had equal competency to somebody who's not a Christian. At the same time, if there's no Christian therapist who specializes in tic disorder treatment, and there's a non-Christian therapist who does, so tic disorder is like involuntary noises or movements that sometimes people can engage in. And there's somebody who has that special area of competency who's not a Christian, who's still open to and receptive to you talking about your beliefs. In that case, I'd say, hey, it might be a good idea to seek the treatment from somebody with that specific expertise. Obviously, there's a lot of gray areas in there. Anxiety, depression can sometimes have an aspect of faith, but there's also aspects that are not about faith. And so I think it really, I think it depends on kind of the amount of specialty that you need in a provider. And like Stephanie was saying, unfortunately, Connecticut is not abundant with Christian therapists in general, especially those who have openings. So which is a problem. Like I've never lived in a state where it's such a problem. It's really hard. So I think, keeping in mind, like, I think the idea of common grace, like that God has provided knowledge and resources and training to many people who could be helpful and may or may not be as helpful as a Christian therapist for certain things, but also could have specialized areas of competency even if they're not Christians. Anything you would add to that, Stephanie?
I think on the medication piece, I think it's like just a little bit easier to draw the comparison to like, do we need a Christian primary care doctor? Do we need a Christian OB-GYN who has all the same values around like when does life start, right? And you may have different views on that, but I would say the majority of people who are able to find a primary care doctor that they can click with or an OB-GYN who is competent to perform a C-section, like they kind of are able to work with you around that. And so again, just trying to think about, mental illness is different in some ways, but in a lot, there's a lot of overlap too with kind of how it manifests in the body and how do we choose our primary care doctors, right? And we think about other factors. So it's just kind of sometimes helpful to think about how do we treat other medical professionals as well, and what do we expect of them.
I think psychiatric or mental health problems are different because they deal with our mind, our thinking, and our emotions. Whereas going to a primary care provider, not really.
Yeah, no, absolutely. I would,
yeah. Or who cardiologist.
And I would say like this is where we try to balance a little bit about the sense of like the brain is an organ too, right? It's a physical thing that also can fail us in the ways that our hearts can fail us and our livers can fail us. And so there is something about medical care kind of bringing it back up to a working state that is very similar to, my liver is failing and I need to talk to somebody about what I can do to prevent further damage. How can I kind of live with this as a chronic condition, right? I think that is true for a lot of mental health conditions as well. And then I agree that I think that there's a certain vulnerability to talking about the past and the emotions and how we're dealing with that is a little separate from just a very straightforward like procedure kind of a thing. But I would say, in areas of an eating disorder where your electrolytes are out of balance and your heart is at risk, or where somebody is psychotic and it's due to, in part, to a dopamine imbalance, or there's somebody who yeah, exactly. But, how do drugs affect our bodies? Where are the where are the effects? That kind of a thing. I think that there is still kind of more clear biological reasons, and in that case, somebody with a biological training can be helpful. And it's a really hard balance. I think you're right that we tended towards like a very materialist view sometimes, in secular culture of, mental health is just neurotransmitters kind of running amok, or it's just like neural circuitry kind of a thing, versus maybe sometimes over spiritualizing, some of the depression and anxiety. But I think we're really trying to find kind of that balance of how do we integrate both, because it is really a combination of both.
And a problem with psychiatric mental health disorders is that our brain is enclosed in our cranium and we can't visualize it like we can with other parts of our body. We can do an X-ray, a CAT scan, an MRI, et cetera, all this testing. We're actually looking at the organs. It's not that easy with the brain.
Yeah,
Right.
absolutely. Right. Yeah, and that's why it is so hard to comprehend, right? I think that kind of that overlap of neurology and psychiatry is sometimes tricky, but where, scans are able to tell us, oh, here's a tumor that's causing you, damage, versus, oh, here are these things, hormones and neurotransmitters. It's a little bit harder.
It's easier for therapy. You can go in there and do surgery or whatever you need to do, an ablation, and in the brain, you can't do that.
It's challenging.
Or they used to, and it did not turn out so well. I said, well, they used to do surgery for kind of like that could not be treated, mental health conditions, and it.
And I think you had a question too, or did you say a hand raise or a comment?
No, I had a comment. Yeah, I was going to speak to the vulnerability. I think it's, when I break my arm, I don't mind someone looking at it, sharing that. But if someone has something more personal or more mental going on, I think there's a big vulnerability aspect. And treatment is not that simple, and it doesn't always make sense to us. And really, we get kind of caught in our own mental fog. Whereas, a broken arm, I can trust almost anybody in a scrub outfit for. But other issues, it's not that easy.
Yeah, absolutely. And I think kind of to what Stephanie was saying, for different people, the medication prescribing piece could be different from the therapy piece. For me personally, I'm more comfortable seeing somebody, like medication prescribers usually see like once a month or once every few weeks. I'm more comfortable, and you don't go super in depth. It's more about side effects and kind of like for some medication prescribers. So that doesn't feel as important to me if they're a Christian, versus therapy, an hour a week, really diving into your trauma and your life history and your emotions. That might be more important to see a Christian for many people, right? So it can kind of vary based on the level and the, like what you're looking for. Yeah, if you're looking for medications or therapy, but that's a great point. Yeah.
I think it's also helpful to recognize the wide spectrum of self-identified Christians.
Like Stephanie was saying.
Like you could go to a Christian therapist and still be like, oh, like this person does, is not on the same level in terms of thinking about God and holiness.
Yeah.
It's true. I used to drive to Hartford to see a Christian therapist who ended up wanting to realign my heart chakra.
Right. Yeah. There's a lot, and so you can't kind of tell from somebody's website profile all the time, like what Christian means, and so that's why often asking the elders, asking a friend for a Christian therapist recommendation. Good. Yeah.
How often or how likely is it that you can, in your first session, spend time asking them about them, like interview them as your
Yeah.
I didn't know if that was like
Yeah. I think you definitely can. People have different comfort levels on what they're willing to answer, depending on their style and kind of their training and things like that. But especially if you told them, hey, it's important that somebody is like understanding my beliefs, and that's why I'm asking. I feel like most people would really want to work with you on that, I would say.
Yeah. Right. I think it depends on kind of what type of therapy they're trying to do, right? So again, if it's like very behavioral focus learning skills, they probably are happy to tell you their credentials and kind of where they're coming from and their philosophy around it. But if somebody's like, hey, how many kids do you have? And like, where do you live? Like that might come off a little different.
But you can ask, and it's up to them to say, oh, I answer this and that. So you can ask whatever you want, and they can answer. Yeah, Carolyn.
How do you guys think about it? Because you both are Christians who are therapists, but wouldn't necessarily promote yourselves as Christian therapists in your work environment, is my guess.
Yeah. I mean, so we work with a wide variety of students, mostly students who aren't Christians. And so I'm really, like, I never hide it, right? Like, I'm never trying to hide anything. And if somebody asks, I'll absolutely tell them. And I think it's pretty widely known in our setting that we are Christians. But if somebody is not a Christian, and they're not coming in for Christian concerns, it might not be relevant for me to share that. Probably won't be helpful for them in that moment. But I also don't keep it a secret.
I think it's tricky in terms of kind of as a culture we are shifting towards, what are our identities, our various identities, and really wanting a match in terms of identities. What, race, gender, orientation, religion, that kind of a thing. And so sometimes it just isn't possible. But sometimes we do get quote unquote matched. And I think it is actually interesting that most of the people, at least in my experience, who are even asking for a quote unquote Christian therapist, when they talk about the things that are bringing them in, it may be more that they just want somebody who's not going to judge them, right? Who's not going to say, oh, your belief in God is so infantile, versus here is my thing that I'm dealing with, that I'm wrestling with the Lord, that really needs biblical advice to weigh on, right? And so I think a lot of that desire is around which is common to all of us, right? Is, can you understand me? Can you respect me? And so again, I think that's kind of the more salient factors when we are limited, the side of heaven with who is available and who can see us.
I have a question. Kind of a generalized question. It's not a criticism. I'm just curious. In general, psychologists like you, how much do they understand the pharmacology involved, the different antidepressants like benzodiazepines and SSRIs, SNRIs, tricyclic antidepressants? Do most psychologists understand that and how they work?
I wouldn't say so. Yeah. I think, which is definitely good to, I have a general idea, especially more SSRIs, because that's, I hear about them more anecdotally, and take them, but I think it's important to consider somebody's degree specialty really for what you're going for. So if you are wanting medication advice, if your psychologist is giving you medication advice, that's a red flag, actually, because somebody should really have the degree training like Stephanie to be able to weigh in on that. And so sometimes people try to kind of get outside of their area of expertise and weigh in on what it's appropriate for your therapist to say, hey, I would really encourage you to take medication. That's appropriate.
Or at least get a medication consultation.
To get a consultation, exactly. But it wouldn't be appropriate for them to say, I think you should consider it.
No, I'm not
I'm
just wondering their understanding of
exactly.
Right, and I think again it speaks to the brokenness of the mental health care system, because there is such a shortage of mental health medication providers, that primary care doctors are often doing the medication piece, and there was a movement around, which is not to say that PCPs can't do a good job, but just there is not somebody who necessarily has that specialized training. And also there was a movement in Connecticut to allow psychologists to go through some training to prescribe medications, and that may happen, but psychologists to prescribe medication, because that would at least widen the group of people who can help with that piece. But I think there were enough concerns raised, at least in this moment, to kind of put a pause on that. Yeah.
Some psychologists wouldn't prefer to do that. Well, there's so much good discussion. Maybe we should move on to the what. But if we would love to hear other comments too, as we have time at the end, about whether or not to see a Christian, when to see a Christian or not. There's a lot to think about there. So in terms of the what is therapy, I think this is not necessarily always obvious, right? Especially if you haven't been to therapy. Like, when you go, what exactly do you do? Like, what can you expect? What can you not expect? So there are different types of therapy. So generally, individual therapy, you're sitting down one-on-one with a professional, talking about what's bothering you, and they're helping you relieve your symptoms. But that can look so many different ways, of course. And so a very general sketch of what things could look like. One form of therapy is called CBT, cognitive behavioral therapy. This really lends itself well to anxiety disorders. It's especially commonly used for anxiety disorders, often for depression, usually used for OCD in some capacity. So this type of therapy is really focused on helping change your thoughts and how helping change your thoughts can help you feel better. So for example, let's say somebody has really severe test anxiety, like a student has bad test anxiety. Every night before tests, they're throwing up, they can't sleep, they can't function the day before because they're convinced they're gonna fail, even though they've never failed a test before. That person would be a really, really good candidate for CBT, because the therapist would say, hey, like, let's kind of examine the facts. Like, you've never failed a test before, it's unlikely that you're gonna fail it this time. Obviously, it's a little bit more in depth than that, but that's kind of the general approach, is helping them change their thoughts and beliefs, and helping them think more sort of realistically and less self-critically. So I think CBT often can feel pretty comfortable for Christians because it does align with our, as Christians, our belief in right thinking and right beliefs. So even Stephanie pointed out this verse when the psalmist is asking, where's your God? These things I remember as I pour out my soul, how I used to go to the house of God under the protection of the Mighty One, with shouts of joy and praise among the festive throng. Why, my soul, are you downcast? Why so disturbed within me? Put your hope in God, for I will yet praise him, my Savior and my God. So this person is kind of doing CBT on himself, right? Here he's saying, why are you so downcast? Remember these things, remember these truths. And that's oversimplified, but that's generally what CBT is trying to do. CBT is often usually more time limited, so it can be like 10 sessions, and it's more targeted. So that is one form of treatment that's out there. Basically, so like if I'm talking with Stephanie and I'm the therapist, and Stephanie's coming in and saying, hey, I'm really anxious about what people are thinking about me. I can't get it out of my head what people are thinking about me. Then I would talk to Stephanie and say, okay, let's like write down your thoughts. So I would have Stephanie keep track of her thoughts throughout the day. Like, she'll say like, oh, I think somebody hates me. I think I'm a bad friend. Somebody's mad at me. She'd write down the thoughts. Then she would bring it back to session. This is what might happen. And then I might say, okay, let's go through these. Like, do you think that's true? What alternatives to that might there be? What are you believing about yourself that might not be true? If I was a Christian CBT therapist, I might say, what is God? What might God say that might be different from what you're saying? And
I think there's a lot around CBT of just even, so sometimes people are like, oh, I just feel really tense in my body. I feel really anxious. I can't sleep. You know, they've kind of gotten all the medical piece checked out, but they're not aware of kind of what are the thoughts and circumstances that are bringing out that tenseness or inability to sleep. So I think part of therapy is even learning, how do we monitor the thoughts that are going through our head? Where are we noticing that we're getting really upset, right? You know, and so learning how to pay attention to our thoughts is kind of that first step. And then, like Alina was saying, really questioning ourselves a little bit, like, oh, like even if this feels really true, you know, my friend didn't respond to a text message for a couple hours, they must be really mad at me. And even if that feels true, is there a way I can talk back to myself, ask myself like, okay, you know, is it possible my friend kind of got busy and forgot to respond and they'll respond later? Is it possible that maybe their phone broke or something like that, right? So again, taking a step back, differentiating between like what that automatic way of assuming somebody's mad at us or not liking us, and being able to question, well, what evidence do I have for this or against this, and is there a slight possibility it's not so personal as, oh, my friend deliberately is ignoring me because I did something wrong to them.
Mm-hmm.
Yep.
So I I'm familiar with CBT. So is it the form of like stop thinking that? Right? But also like
Kind of, yeah.
So like,
Go ahead.
so I think the idea of like kind of stopping in that moment to notice what's happening, and then thinking, kind of paying attention to what are our thoughts in that moment, and is there a different way to think about it, and is there maybe a different way to act around it? Might be kind of is what I would say as a course.
It was introduced to me like in school. Not like I went to school for it, but like we had to go to group. So I went to a private school in Arizona. That was like kind of Christian based a little bit, but it was like very intense. But it's like it was introduced to us as like from acting on impulse and stuff like that, card stuff,
Right.
role playing, like
Yep.
in the now, thinking, writing,
Yeah.
but mostly like just geared towards like, I didn't know it was like geared towards like anxiety.
Right. Yeah, and I think it speaks to kind of like how in the moment when our feelings can feel just very overwhelming, we're just kind of in that mental fog, right? Is there a way to take a step back from that, calm our bodies down a little bit so that the part of our brain that's like fight or flight isn't just kind of blaring, and be able to kind of make choices that are more helpful to kind of our goals in life.
Stephanie can talk a little bit about psychodynamic treatment.
Yeah. So I would say like in terms of therapy, right? Like Elena's talking about skills-based, targeted sort of treatment, and that's one big category. And the other is a little bit more process-oriented. And so kind of that question of, how much is a therapist going to disclose to you? Like here, it might be where the therapist is what you're bringing into the room is what we're working with. And so they might be a little less inclined to tell you like all about themselves because they don't want that to get in the way of focusing on kind of what you're working through. And so psychodynamic psychotherapy, might be kind of where Christians get a little like about it because it's associated with Freud, who said a lot of different things. And I would say, don't throw the baby out with the bathwater with this one, because I do think that there is a lot of wisdom in this type of therapy, which is really about acknowledging the conflicts and emotions and desires we might have, how those might be unconscious and instead kind of acted out in different ways. And when we bring it into awareness, how do we make choices about it, right? Because I think it's hard to make good choices about how we're acting if we're not even sure what is the thing underneath that's driving it. And so it might be, for example, right, like a mother going to therapy saying, I really love my child, but also like, I kind of hate my child sometimes, right? Or it's like really hard to be a caregiver for somebody who is really debilitated. Like I want to help them, but also I just want to do my own thing and be independent. And I think sometimes that can feel threatening to us as Christians because we want to be pure and holy and blameless before the Lord. But I would also question, like, are we thinking that God can't handle the spectrum of emotions and the complexity of emotions that we bring before him? And that there is a way in which when we're able to acknowledge these desires and conflicts, that we're, again, we're not just talking to the therapist, but also realizing, like, bringing this before the Lord and submitting this to him and saying, like, yeah, I really desire to be a better mother or a better spouse. And also I have all of these other desires. So like, Lord, this is something we're going to have to work on together, right? This is about inviting the Lord into the specifics of our situation rather than holding our desires at arm's length and like kind of denying and being like, oh, no. Like I really love being a mother 100% of the time, And so I think there is something about understanding the specificity of our wounds that allows Jesus to speak about who he is specifically in a way that is really beautiful. And so that, we kind of came up with a vignette together of, maybe there's a person who growing up their parents had really high expectations for them and nothing was ever good enough, and then they, did decently in life, but also kind of struggled with a sense of never being good enough, feeling inferior. And so they start feeling depressed or really anxious if they fail a test or whatever. They go to therapy, they're working through what it means that their family of origin, maybe never outwardly abused them, but also emotionally weren't really there for them. And so that's part of the work of therapy. And then maybe as a Christian, it's also being able to receive from the Lord that he is our Abba Father, that he delights in us, that we are his beloved, right? And that might be different than somebody who is working through in therapy, somebody whose parents really did physically abuse them. And there's a lot of trauma to unpack around that. And maybe in that case, bringing that hurt before the Lord looks like really resting in God as a refuge and a stronghold and a protector, right? And so there are these kind of beautiful images in the Bible that speak to all these different aspects of who God is, that I think therapy can help us kind of uncover, what is it that we are struggling with that maybe the Lord can speak to specifically in a verse or a picture or a promise that helps us. So that's kind of the, where I would say the process, and then maybe you're really angry at your therapist for canceling on you last minute, right? And so again, that's part of the process of oh, well, when you canceled on me, it made me feel like I wasn't important. And that's something I've struggled with. That's a specific wound, right? And so I think, again, just kind of, maybe we talked a little bit about last week, right? We tend to kind of gloss over the hard parts, right? Because we're Jesus covers everything. And but I would kind of push back a little and say, I think that we should probably understand ourselves a little bit better and the things that we're struggling with in order to be able to invite Jesus to speak to that.
So we'll run through a couple other forms of treatment, and then we'd love to hear questions or comments too. So DBT, dialectical behavioral therapy, is kind of like CBT, but it's more based on behavior change. So this kind of therapy is really good for a lot of things, but especially people who are in crisis of some kind, perhaps they're dealing with self-harm urges. And this therapy really teaches specific behaviors to deal with crisis. So for instance, let's say there's somebody who is really feeling rejected by other people and rejected by friends. When they look on Instagram and see everyone going to parties, they feel really left out and really worthless, and they might experience urges to cut or injure themselves or other forms of self-harm. So dialectical behavior therapy would teach this person skills to avoid that, acting on that urge. So that might be okay, dip your face into cold water, or it could be deep breathing or intensely exercising, or
all of which are to activate kind of a different part of our bodies.
Exactly. And I would say for most people there is a need to then also process at some point in time, why do you feel worthless? Why are you going on Instagram? Some of these other questions, but it's really hard to process deeper issues if you're feeling an intense bodily urge to self-harm or some of the panic or some of these other things. So DBT can really help with those behaviors. EMDR, maybe some of you have heard of. This is a specific form of trauma processing. So it involves kind of verbally talking through a traumatic memory, and then the therapist uses kind of different techniques to help your body respond differently and kind of calm your nervous system. So oftentimes, if we've experienced a traumatic incident, even years in the past, our body and our emotions still respond to that incident even years later. So the passage of time doesn't decrease the intensity of that response on its own. And so EMDR can help retrain basically your emotions. It's called EMDR, and that stands for eye movement desensitization and reprocessing. And certain people are trained in this. I am personally not, so I don't know a ton about it, but it is something out there. Do you want to cover some of the medication cases?
This is a huge area, and I don't know that we necessarily need to get into the specifics, but I think around kind of what are medications, and also within the field of psychiatry, there's an interventional arm. So if you've ever heard of electroconvulsive therapy or transcranial magnetic stimulation, TMS, those are all things that are possible interventions to help when therapy alone, is not helping to the extent that the person is able to function. And so, again, lots of different classes of medications. I mean, I hold it, with humility, knowing that these are not like the most fine-tuned, precise things, and there are pros and cons, and we are still learning so much about it. And there's a lot to say about it, but I would say, like, for people who need it, it has been well tolerated, it's been safe, it doesn't make you into a zombie who's like all of a sudden praising Jesus all the time, but it's really providing a floor so that you're able to make use of therapy. And again, kind of that illustration of, if you're in crisis and you feel like you're drowning, you do need to learn how to swim eventually. You also need to like hold onto a life raft to get your head above water. So not a magic pill, should be done in conjunction with therapy. Really about kind of giving us some mental space to be able to process, because sometimes we're just so overwhelmed by all the things that are happening that the part of our brain that is able to think a little more rationally and make good choices is just not able to be accessed. And then a separate category for people who are hearing voices, seeing things, believing the government is out to get them, really struggling around like not sleeping for long periods of times and doing all sorts of things. That I would say, like, I do feel pretty strongly that those can be really helpful tools. Again, not without pros and cons, and talking about, what that person's feelings about the medications might mean. Like, what does it mean that you have to use medication, or or even coming to talk to me? But where we've really seen people be able to live lives that are a little more flourishing than it would have been without the medications.
It seems like patients, I'm in the medical field, that are on chronic long-term like SSRIs and all.
Mm-hmm.
It's like years down the road, they still have the same diagnosis, they're still taking the same meds. And is my understanding correct, it just keeps the illness, say anxiety, from getting worse?
I think it depends on the diagnosis that somebody might be experiencing. So personally, I take a medication I have for several years because the nature of kind of what I experience is it doesn't ever sort of like it doesn't go away. Even with therapy, it doesn't sort of, it's sort of always there sort of in my brain. So medication keeps me sort of being able to like live a more flourishing life. And it isn't that like therapy doesn't help, it's just that that's an aspect of my OCD that my brain kind of really needs to be able to sort of tolerate that well. Mm-hmm. But even sort of a personal experience, like I was really resistant even to taking medication. I remember my therapist had to like talk me into it at a point in time. And I think I felt like it was giving up or something, or like that I wasn't working hard enough, or that I like should be doing more, or I wasn't doing something right to need it. And then I started and I was like, oh, this doesn't change me into a fundamentally different person. This just makes things a lot easier for me, honestly. It makes it easier to engage in therapy and work and everything else. And so I think some people might need a more short course of medication, like maybe they need it for a year to be able to get through a difficult time. Some people, depending on the nature of their diagnosis, for example, like bipolar disorder, psychosis, like OCD or some forms of depression, things like that, people just generally might need it for a long time. And that doesn't mean that they're not working hard, it just means that like their brain really can't function well without or as well without that medication. Yeah.
And I think the tricky part too is like we use the word depression as if it were like one thing, when really I think it's tens of different things, right? That somebody who's depressed because they're going through a hard time is different than a person who's been kind of feeling sad and moody and irritable ever since childhood, right? And so there's so many different things. And so when we talk about like what is needed for a person, it really is on a case-by-case basis. And I would also say that, again, if we draw the comparison to medical illnesses, somebody who has high blood pressure some people might be able to manage by exercising and having a good diet and lowering their salt intake. Some people need blood pressure medications to lower that, and some people might need that for a lifetime, right? And again, there's so, like, most of medicine is usually, I mean, I would say that a lot of it is chronic conditions, right? And so I definitely agree that there are probably, some of my work is taking people off medications, right? Because I do think there is definitely something to be said about overprescribing. And when it's appropriate, I do take people off medications. Again, just trying not to throw the baby out with the bathwater, that like there is a lot about our health, both physical and mental health wise, that tends to be chronic and needs kind of chronic support around that.
Yeah.
I was wondering if you could explain, there's something called, I'm not sure the terminology, response exposure therapy.
Oh yeah, so that's a exposure and response prevention. It's a form of CBT. So if somebody's experiencing an anxiety disorder, it helps somebody desensitize to their fear. So let's say somebody's really scared of mice, for instance, and can't even step into an old house because they're fear of seeing a mouse. They might start by looking at pictures of a mouse and tolerating that level of anxiety. Then they might go to a pet store and see a mouse through a cage and tolerate that level of anxiety, and then finally get within 10 feet, and kind of so on and so forth. So good question. Does anyone else have thoughts about, medication, Christians taking medication? Yeah.
So there's a movie, I haven't seen it in a couple of years, but it's called The Beautiful Mind, and it's, I think
it's a good movie.
Well, it tells the story of John Nash. I think he's a really talented mathematician, but he struggled with kind of schizophrenic, hallucinations, things like that. And when he stopped taking his medications, he really couldn't tell that he was having these hallucinations or that anything was going on. It just, he couldn't distinguish real and not real. And then on the medication, it's not that they went away. It's not that he didn't have these, they were like people in the movie. It's not that he didn't have them, but he could tell that they were hallucinations. So it does a really good picture of painting the people, instead of being in his house or in his car, of them being in the distance. So he's still working at the university, but they're not in his classroom. They're not sitting in the chairs. They're in the background, and they just kind of loom there. And I think that paints a really good picture of he's not going to be better. He needs that medication long term, and they're still going to linger there. But he's so much more functional, and he has a grasp of reality, rather than being caught up with those characters. And the movie does a good job making them characters. So good movie.
Yeah, that's a great illustration. I like that.
Should we look at medication as like a maintenance? I have hypertension, high blood pressure. I've been on 2 different classes of drugs for years. My blood pressure is under good control. And probably if I didn't take them, it may shoot up and have a risk of a stroke or a heart attack. So is it kind of the same with the psychiatric meds? It's like
I think,
diabetic.
Right, exactly, yeah. So much of what is common for our bodies is chronic, and I would say there is a decent subset of people for whom I would say that is appropriate. And I would say it's always worth, if they're young and a number, and I would say it's depending on the person. Sometimes it is worth trying to take them off and see how things go. And then it's not a terrible thing to like kind of put them back on it. And that gives us a little bit more information. So it might be like, you try to come off your blood pressure medication and you're still doing the right things, but your blood pressure is still like sky high. It gives you more information. You need to get back on it. And then there are some people who take it for a period of time. And again, these are not like, these are medications that take like 6 to 12 weeks to even consider it a full trial, right? And so it does take time. And so for some people, they may be able to get through a hard circumstance with the help of a medication, learn some skills in therapy, and then when things are in a more stable place, they're able to try to come off it. But I'm just saying, like, I guess maybe the point is that everybody's so different, right? So for somebody to be like, oh, like, what's wrong with you? That like your gout is not under control, right? And you still need to take allopurinol, like, I think is to be a little bit not acknowledging that for some people it can be chronic. Yeah. Dean, you have a question?
So, from listening to the conversation so far, seems like there's a lot of reluctance to deal with mental illness. And I'm an internist. I do a lot of psychiatry also. And I see that in my practice. I mean, so it's one of those things that, how much of it do you think is pride, and is that a set for you to say, mental illness I can handle myself. I have a heart attack. I'm gonna try to handle it myself.
Or you might. Actually, no. Anyway. You might.
That's a good question. I mean, I don't feel like I could speak to each person's heart, right? Like, only each person knows before God. Only God knows, like, the reasons why they may or may not be seeking mental health care. Maybe they've had terrible experience with therapy in the past, and so they're hesitant, and I can't blame them, right? Like, for being hesitant. But yeah, I do sometimes think that, like, maybe especially as Christians, we're slow to admit areas that we need help with mentally or emotionally, because that feels especially vulnerable or weak or embarrassing, or isn't part as much of what we talk about. So I think that there could be an element of pride, depending on the person.
Isn't it a social, cultural thing too? Like, I mean, if I suffer from suicidal thoughts, which I don't, but I would be more reluctant to say something, but I don't have any problem with saying I have high blood pressure.
Yeah.
But, then you say like I was schizophrenic, or people are very reluctant to admit those things. It's the attitude. You shouldn't judge people.
Yeah, when you go into like talking sessions like just speaking on experience, stuff like that, like heavily influenced on the big talk of like, yeah, man, toughen up, you feel me, you'll be all right, or like to not really like process your emotions or what's going on that causes these issues.
Yeah.
And then later on to come talk to somebody about them. Like, how do I know how to address that? How do I know what's really bothering me if I've never been allowed to process or think what's been causing this, or like what made me this type of way?
Right.
Yeah. I think that speaks to kind of like maybe our next section, although.
And if anyone needs to go, feel free, because I realize it's 10. We'll try to fly through a few of our last points and we just do questions, but if anyone needs to go, don't hesitate. Yeah.
But I think this idea of like when to seek help, sometimes there are clear red flags, which we can talk about, and then sometimes it can be hard to acknowledge we're going through a traumatic event if the trauma is still happening, right? And it's really not until we're in a place where we've kind of surfaced that we're able to say, yeah, that was really terrible, right? But in that moment, you're just trying to survive, you're just trying to get through, and that's okay, right? And so I think that it may be that like terrible things are happening and you're just kind of feeling like you have to survive. It may not be necessarily the right time to seek therapy. And I think to Dean's point, right, like of people saying like, oh, I can deal with this on my own. I think that therapy, there are certain ways that we talk about things that maybe can hopefully help the person think through what is and isn't working for them. But I don't think that therapy can just magically be like, oh, you have this problem and now you have all the motivation to process it, right? So therapy in and of itself can't motivate us to seek help. And so sometimes it is an issue of time or enough feedback from other people, or, maybe sometimes it's getting fired from a job. Maybe sometimes it's, a relationship failing that, brings that person to a point where they're like, oh yeah, what I thought was working might have worked in the past, but it isn't working for me right now, right? But that's something that a person kind of needs to come to a conclusion about before they seek help.
So just a couple, maybe we can run briefly over a couple of these points. So one concern.
And we can pick up week 4 too.
What's that?
I said we can pick up.
Yes, exactly. So maybe, maybe we'll go over what therapy can and cannot do.
Okay, yeah.
And then we can kind of cover a couple. We have so much to talk about with this topic, but it's hard. So just really quickly, I think there is a genuine concern sometimes Christians or people ask, like, in secular society, are people making therapy like their God? And I think sometimes it can, for people who aren't people of faith, like it can have almost sort of like this like religious, sense of like, this is what will truly help me. And we also think that's not true, right? Like as mental health professionals and people who are Christians. So in terms of what therapy can and can't do for you as we see it, so it can help you relieve your symptoms, it can improve your mood, it can make you less anxious. I do think with that it could sort of remove barriers that might be getting between you and God. So for instance, like if your mood is so low that you can't go to church or read scripture or engage with other Christians, therapy can help you sort of free you up to spiritually engage with God. Or if you're so anxious that you can't read the Bible without ruminating, that it can kind of free you up. It can improve your relationships, like with psychodynamic treatment, like Stephanie was talking about. It can help make you more self-aware of what you're doing so you're not just acting out of reflex. So if I find myself yelling at my husband every day and not understanding why, right? Like he probably wants me to go to therapy to like, understand why are you doing that? Why do you keep acting, sort of out of that reflex? So some things it cannot do. So it cannot give meaning and purpose to your life. And I do think that some people who don't have a foundation of God can look to therapy for something that it can't give. So for instance, somebody who's experiencing depression might feel really bleak and hopeless about the future and feel purposeless, and therapy can help improve their mood. It can give a space for them to talk about what matters to you, what do you want your life to look like, reestablish goals, but it can't give someone an ultimate purpose for living, right? Or an ultimate reason for existing and motivation. And I think sometimes that's where, if you think of God first and therapy second, sometimes if that gets turned around, people can look to it for something that it can't do. And it cannot, like Stephanie was saying, it cannot inherently give you motivation to work on yourself. So I think sometimes maybe we think this as friends or family members, like, oh, so-and-so really needs to go to therapy. If they just went to a session, they would start to work on themselves. And not really. Like therapy is a tool for them to work on themselves if they have the motivation to do so. But just kind of getting someone to one therapy session, they may or may not be in a place where they feel ready to do that. And I would say too, it cannot override the human conditions. Like we're speaking, like the human condition, it can't, speaking to the chronicity of mental health, like going to therapy can't remove our vulnerability and frailty as humans or our susceptibility to mental illness. And oftentimes we might go to therapy or take medication, and like you were saying with the Beautiful Mind movie, our mental health concerns might still be always lurking in the background, and that is part of our experience as people on this side of heaven, right, for many of us. And that doesn't mean that it's not important, because it's great that those things are in the background and not the foreground, but it's sometimes an unreasonable expectation of mental health treatment that it's going to take everything away.
And I think just to add on to kind of therapy, because we've heard a lot of questions about like therapy versus like Christian counseling or biblical counseling. Therapy, as we've been talking about, is kind of, there are techniques around it that may not get at the existential piece of why we struggle, what is the purpose of suffering, do I matter? And that might be where biblical counseling could be really helpful for, what does the Bible say about our dignity and the purpose of life and that kind of a thing. And I think sometimes we put these in juxtaposition of, is it biblical counseling or is it therapy? And again, I think what we would say is that ideally it's the integration of both, that maybe both can come to weigh in on the specific issue, and that when a pastor or elder feels like, this is something that a trained mental health professional should be dealing with, it's not kind of this game of hot potato, like, oh no, you're it, right? Like, no, you're holding the bag. But it's really just kind of like adding another person into that link, that circle around them, expanding that so that they have more resources. And we actually asked, the pastors what they think about biblical counseling versus therapy. And so they came up with some things that maybe like we hadn't even known how they think about it. And so one is that biblical counseling, and I think they have differing views on whether what they do is pastoral counseling or discipleship. Yeah. That maybe they might actually be hesitant to use the word counseling because that has such a specific connotation and liability to it, but also that it's bringing prayer and God's word to bear on a situation in a way that is probably more targeted and short term, and that that even things like grief, where the Bible has a lot to say about death and suffering and grieving, but if it's complex or if it was particularly traumatic, right, that might be where adding in a mental health professional could be helpful. And also, and so there's that piece of kind of what biblical counseling and therapy could look like, and then also kind of the logistics of it, that it's biblical counseling or pastoral counseling and discipleship is something that all the elders are privy to, so it's not confidential in the way that seeking mental health treatment is confidential. And again, in an ideal world, right, there would be this integration of both, but oftentimes people feel like they have to choose.
So when we spoke with Pastor Nick and Pastor Matt and Tom and the elders, so the general approach of our church is they are very comfortable making referrals to mental health professionals. The elders feel really conscious of not like overstepping their boundaries out of competence. And so if there's anything that might involve a mental health diagnosis, they want to refer for that, while also not withdrawing their own care and their own presence, but just adding in that mental health component. And so maybe should we run over the whens really quick?
Sure.
So just kind of a few things of when to seek out help. So if you are, I would just say, if something is really, really bothering you to the point where it's always on your mind, it's hard to function as you used to function, you're not feeling like yourself, that is a really good indication that it's a good idea to get support. So we consider kind of like the length something's been bothering you. Like if you're feeling bad for 3 days, but you felt fine before that, that might not be as much of a need for therapy as if you've been feeling bad for 5 years or 5 months, right? If you're like, I think about this once in a while, but generally my life is fine, versus like, really, I'm thinking or experiencing this every single day. Definitely time to get support. So I often think like if you feel like you need support, you probably do, and it's probably a good idea to seek that out. I think we kind of covered that. Some red flags for when you should definitely not try to deal with something alone, either for yourself or for somebody else, is if there's any sort of risk of self-harm involved or suicidal thinking. That is not a time when we would ever want somebody to worry alone or worry by themselves. That's can be a high risk situation. And so really ensuring that somebody can get help as quickly as possible if they're dealing with safety concerns is important. Eating disorders, those tend to have also a high risk of health risk. And so we think, really important to get somebody into treatment right away, dealing with an eating disorder. Psychosis, so if somebody's hearing voices, seeing things other people don't see or hear. If somebody has bipolar disorder, so they might be experiencing like days on end of not sleeping, behaving recklessly, acting way out of the ordinary, that's a good idea to seek help right away. OCD, just kind of a more specialized treatment that's needed for that. Sometimes trauma treatment can just be very complex, and somebody needs a certain level of training to be able to deal well with that.
And this is all interwoven with like when there are safety concerns or things that might require more specialized forms of treatment. I think it also interplays a lot with like where does that treatment take place? Does it take place outpatient? Does it take place in a hospital where there's 24/7 nursing care? Is it somewhere in between where you're going multiple times a week to a partial hospitalization or integrated outpatient program? But again, like these are, I think this is less about like telling you to triage on your own and more just kind of like, this is kind of the spectrum of care that we have, that there's, that therapy and medication help can look different across these different settings, and depending on where the person is, they may benefit from kind of more structure versus like being at home. Yeah.
All right, well, maybe this is a good place to take questions, comments. Of course, if you need to go, that's totally fine. But yeah, Jessica.
I just wanted to comment kind of in response to what we were talking about earlier with like why people don't get treatment. I think sometimes it may be pride, but I think sometimes it's like realizing that like what I'm going through is enough to warrant. Like you just went through some of the wins and it's like, oh, like I don't know. I think maybe it's not universal. Maybe it's just me. There's some things that I'm like, oh, maybe this would be helpful. But I have felt that I need to reserve professional time for those who are like dealing with these red flag issues. And like I don't feel like that's necessarily where I'm at now, but like perhaps I could still be better.
Yeah.
So it's, I think a lot of it is just like maybe being told that I need to deal with it myself, or realizing like just realizing the magnitude of what I'm actually going through, not being aware of that. Like, so I think sometimes it could be pride, but I think maybe like education or whatever. Like,
I think that's such a good point, because we often hear from so many people, oh, I didn't realize it's not normal to feel this way, right? I didn't realize that not everybody struggles with walking into a room and freaking out and not knowing who to talk to because it all seems like white noise, right? I didn't know that other people don't have to spend hours and hours, getting out of bed and talking themselves through it, right? And so sometimes it's, whether it's a close, if a close friend or a spouse or a partner, or a family member is kind of like, have you thought, have you thought about therapy, or have you thought about other supports? That's often helpful feedback. And that's also where, again, friends and family members can do things that like a therapist within a setting can't do, right? And so to not minimize the role that, you as a non-professional would be able to do, because sometimes people do need to hear from friends like, hey, it seems like you've really been struggling. Have you thought about getting help? Yeah.
How do you get over the thinking of like, your mess is too messy for anybody else to relate or understand? In a therapist setting, or like in a friend group setting, you know what I'm saying? Like how do you learn to get over that kind of stuff?
Yeah, I mean, it's tough. I think sometimes we think like, how could a therapist help me if they haven't been through this specific thing? And I think one thing to keep in mind, most therapists go into the field because they've been through something bad. I feel like I almost know no one who went into the mental health field unless they had like a personal reason for doing so. But I think it's true, like your therapist will not have your same experience, which has, I think, pros and cons in some ways. Like maybe they don't have like as totally an understanding of exactly what you went through, but there might be a degree, if they're curious and respectful, there might be a degree of objectivity that them not having had the same experience could in some ways be helpful. But you've got to make sure like that they can understand you enough that you feel comfortable. Yeah, Carolyn.
I was just gonna say, I think also it's sometimes helpful with those like worries of like, is this too much, particularly like for my friends or my family, or is this like too messy, or I don't want to burden, which are all things you can work out in therapy. But I think to have someone you're like, oh, this is their job. But like this is in some ways a service, right? Like whether I'm paying or my insurance is paying them. And I think there's power in just like speaking things aloud to another human, even if that human doesn't necessarily have been experiencing the same thing, to like have someone who's like outside of this like of your life, that like in some ways I like don't have to necessarily worry about the other person's emotions or what they're carrying, because they kind of signed up for this. And like ideally that's also true of family and friends, but I think sometimes when that's like my worry, it's like nice to like take the first step with my therapist, which then like helps me be more open with people for whom like I'm closer to or just have more interaction with.
I would say too, like sometimes when somebody has not had your experience, they can actually be more empathetic. So like, let's say you've gone through a certain difficult thing in life and you're around someone who's gone through the same difficult thing, their response might be like, okay, it's normal, kind of type thing. But if somebody has not experienced that, they might be like, oh, wow, that is a lot. And that actually might be a more healing response than somebody who's like been there, like obviously, hopefully a friend doesn't do that. But sorry, there was a question in the back.
Actually, it's a comment as advice. you know, I can talk to you, I mean, this is your talk, obviously, I don't want to go into, but one advice I would recommend is fellowship. To get together with friends and fellowship together, and especially Christian friends, is that, you know, you talk to people, some of your age, your background, who have similar thought patterns as you, and then you open up. And when you open up, things get better. And God kind of like, you know, looks into you, heals you when you open up. You keep it inside, it just smothers and just kind of like, you know, it's a, you know, fellowship.
Yeah, I think the community aspect is very important. And again, something that therapy in and of itself can't provide. And that's what we'll talk about, not next week, but the following week. Yeah.
Oh, good. I just wanted to piggyback on that and thinking about this is that community is very important. And working with peers, with people who are struggling with the same thing, and having that in the church would be amazing.
Yeah.
So there's a lot of community in the outside world, outside of the church. Amazingly healing and uplifting.
Right. And the church being a place, that should be a place of like, you know, where we come with our brokenness and seek healing together and are vulnerable.
So there's no stigma. I mean, it's very easy to feel the stigma in the church and everywhere actually, but have that kind of community is very healing.
Yeah, I think and that's a great segue. I think we're taking a break next week, but the last week we'll talk about, you know, how can we,
Extension.
I'm out of town next week, so we're on pause, and then we'll be resuming and ending. Our final week will be, I guess that's the Memorial Day weekend, the following, the 27th or 28th, something, whatever that weekend is, the last weekend of May.
But I think very much to your point of like, how can the church be a community for those who are struggling?
So bring your ideas.
Like within church or like without?
Oh, specifically within church is what we're thinking. Within this church, within Christian
Churches
communities.
in general,
How can we better support one another in struggling with mental health?
Are all these on the website?
Yes. Yep. I believe the first two are currently already on the website. In fact, I know they are. And then this one should be uploaded in a few days, I would imagine. Oh, cool.
Oh, YouTube and they're on the church podcast too.
To say, even though I don't call this like community, small group, but I think that this is wonderful, and kudos to you too. I've been in the church all my life. I've never heard of this issue addressed. I know it's, you know, not specific to a specific psychiatric issue, which is unfeasible, but just to talk about things, your biblical perspective, very much appreciated.
Oh, well, thank you.
And very much needed.
Thank you. Thank
you for helping us understand.
Thank you for your comments and participation. I appreciate it.
Absolutely. Yeah. If anyone has other questions, we can hang around. Did you have a question or a comment?
I didn't have a question. I just kind of wanted to go back to what you said. How can someone understand my mess or whatever? You know, how are they? And I went to Christian counseling here after going through something here, and that counselor was like, he was, as you said, so empathetic. What a horrible thing to have gone through. And I was like, thank you. And I guess the other thing about Christian aspect is they pray with you. And that's why I like a Christian therapist.
For sure. For sure, yeah. And that's a good thing to know, because if you go to a non-Christian therapist, they probably, I can't imagine that they would in most cases. If that's what you're looking for, 100% you can look for a Christian with that.
And not because like because they're like heathens,
they think,
but
they might not know how to
more
pray.
that they're like mindful of like the power dynamics and what is it like to invite someone into prayer, and is that something you feel comfortable with, or are you feeling obligated by it? You know, so just it gets a little sticky.
It's just something that I personally like.
Yeah, absolutely.
For sure. Any other questions or?
Is this like a group also to like test something that can, but possibly like continue later on down or become a different form of a small group within the church that has open discussion about issues and traumas that we face? outside of church and within church?
It's a good question. I don't think we've thought about it, but
I think our hope is still to try to figure out within the church like what can be an ongoing support. I don't think we figured it out, but we're open to ideas.
So approach the elders if you have an idea.
Yes, what we can and can't do.
I don't know whether other churches implement it. I don't go to this church, but I think the pastoral staff, the elders, it would be good in any like evangelical church to have names and contact information in place. You could just say to the pastor, I'm struggling with this or that. Do you know a professional that you can refer to? And I know churches have like groups for those that have been from the loss of a loved one or for divorce and things like that, but just an idea.
Yeah, I believe I asked Tom, who's one of the elders, and I think he said Pastor Matt has some referrals for therapists. I imagine Pastor Nick would too. So if you go to one of the elders, I'm sure that they can get you connected with the list of who's in the community. The hard part is in New Haven, in Connecticut, there's just not a lot of Christian therapists, unfortunately. So we hope there's more. You know, if you know anyone,
you can add to the database.
But I do know that they have referrals, people that they refer to. So well, thank you all so much. We'll hang around if anyone has any thing you want to share, comments. But thank you so much. We'll see you in